Good morning, and thank you for joining us. I am Reggie White. I'm the Senior Vice President of Commercial Markets and CareFirst Administrators at CareFirst. I would like to welcome you all to today's discussion on employer health benefit innovation. All of us gathered here today are well aware that access to quality, affordable healthcare services is always associated with better outcomes. We also know that inadequate health insurance coverage is one of the biggest barriers people face to healthcare access, and that lack of coverage leads individuals to delay or forego much-needed medical care. Fortunately, 180 million Americans, or roughly 60% of all non-elderly insured individuals, are enrolled in comprehensive employer-sponsored insurance, and 50% of children receive health coverage through a parent or a guardian's job. Thanks to the Employee Retiree Income Security Act of 1974, or ERISA for 50 years, employers have pioneered innovative, market-driven approaches to providing health benefits with overwhelming success. Survey data shows well over half of Americans are satisfied with their employer-sponsored coverage and prefer to receive their coverage through their employer rather than through the federal or state government. As the cost of medical care in our country continues to rise, and we all learn how to adapt to a more remote-friendly workforce post-COVID, the need for employers to have flexibility to structure and design unique and affordable benefit plans is greater now than ever before. Today, CareFirst is thrilled to host this panel that will share their firsthand experiences of implementing successful employee well-being programs and innovative solutions to control rising healthcare costs while still meeting the needs of their workforce. And with that, I would like to introduce you to our moderator, CareFirst Vice President of Public Policy and Federal Affairs, David Swartz. David?
Good morning, Reggie. Thank you very much. Glad you could kick us off this morning. And I'm really honored to be serving as moderator and leading this dialogue today. There was a big moderating job last night, but I turned it down so I could be here this morning and have a timely discussion, considering that ERISA is turning 50 years old this month. So I'm, sort of a big policy nerd, and we could spend an entire hour talking about ERISA and the critical role that employer-sponsored coverage plays and how it helps employers offer a seamless opportunity to provide benefits without having to navigate a patchwork of varying state regulations. But I think we'd have a better time if I let the panelists talk about what they do as boots on the ground, and we can dive into the world of employer benefits from their perspective. Before I introduce the panel, I just want to make a point from the CareFirst perspective. We are, of course, the largest not-for-profit insurer in the Mid-Atlantic region. We have approximately 3.5 million members. And just to put this all in context, about 2.5 million of those receive their CareFirst coverage through their employer or through a relative's employer, just to sort of give you a sense of the magnitude. I'm going to introduce our panel and ask them to actually introduce themselves and talk a little bit about the role that they play, but we are very excited to have three really interesting perspectives represented today. So I will ask Russell Dubose, Marcy Buckner, and Shane Moore to come on camera. Russell is the Vice President of Human Resources at Pfeiffer. Marcy is the Vice President of Employer Health Policy and Advocacy at AHIP, which is an insurer trade association of which CareFirst is a member. And Shane is the Director of Associate Wellbeing at MedStar Health. So I will ask Russell and Marcy and Shane to give brief introductions of themselves.
I'm Russell from Pfeiffer Incorporated, headquartered in Tuscaloosa, Alabama, with facilities and employees in Alabama, California, and Pennsylvania. I serve as the Vice President of Human Resources. I've been with the company 24 years. I've served in this role since 2017, and I dual hat and serve on our healthcare team as the healthcare strategist. Thank you.
Good morning. I'm Marcy Buckner, Vice President of Employer Health Plans and Advocacy here at AHIP, which is America's Health Insurance Plans. As David mentioned, we are a trade association for health insurance carriers, health insurance plans, and we are located here in DC. So doing a lot of work up and down Pennsylvania Avenue between the White House and the Capitol advocating for employer-sponsored coverage.
Yeah, and good morning, everyone. Thanks, David and Russell, and Reggie for the opportunity to join here. I'm Shane Murr. I'm with MedStar Health as the director of their associate wellbeing program. I've spent about 5 years at MedStar Health here, and the Center for Wellbeing, as we'll talk a little bit about today, is really one of our innovative approaches to supporting our associates and their health and wellbeing needs that formalized at MedStar Health about 3 years ago.
That's great. Thank you again to the three of you for joining us this morning. We have a bunch of questions and want to make sure that we get to hear from all of you. So I will do my best to try to keep us moving so that we can provide everyone who has joined us with the benefit of all of your perspectives and experiences. So with that, for the first question, and I'd like to start with you, Russell. Can you describe your basic benefits and how you've tailored them to meet Pfeiffer's workforce's needs? And please feel free to share some examples of how that has evolved over time as the needs of your workforce have changed.
Sure. We're a mid-sized employer, have 2,700 lives on the plan. We offer a traditional PPO network, no deductible. We're sitting right now at, as a low cost premium, we're at 16% cost share to the plan members. So we watch that very closely. Over the last 6 years, we have tailored our healthcare plan with the intent of trying to eliminate out-of-pocket costs for the plan members at the point of need in order to eliminate access barriers to care. So we've done that primarily 5 years ago. We started with direct primary care, and it's a value-based fixed cost approach. And so we enjoy 65% utilization with primary care. We offer that on-site and virtual. And then we also have built out an on-site physical therapy center and a pharmacy. And the pharmacy offers generic, name brand, and specialty meds. All of those medicines are prescribed at a zero copay. And then we measure the pharmacy's performance on adherence for those medicines. We've launched a nurse navigation program. We do navigate within the PPO to a narrow network of providers that we have identified based on both quality and cost. So the nurse navigators, we do navigate, and we also provide advocacy in the oncology space where the nurses go with the plan members to those appointments. If we don't have great providers in the PPO, we also access other great providers through direct contracts or through bundles. So those have been highly successful as well. We're currently on project building out an on-site chiropractic center and imaging center. Those have been identified through data analysis and also based on what the plan members want. So with this tailored approach, we've been able to stay flat in our net cost for the past 5 years.
Wow. Sounds like Pfeiffer's been pretty innovative. Shane, same question for you. If you could talk a little bit about what MedStar has done and maybe a little bit how that's changed based on the flexibility that you have to design your benefits.
Sure, and maybe to get started mirroring Russell there, MedStar Health, just to define it briefly, a little over 30,000 total associates or employees there. We're largely in the Maryland and DMV area, DC as well. We do have some services like home health that extend beyond the Maryland and DC space into some Pennsylvania, Virginia areas as well. What you'll hear from me, I think, a little bit throughout this presentation, the perspective I bring when we talk about innovating in benefits is more broadly some of our employee well-being steps and efforts we've made over the last several years to really respond to a changing workforce that we've all experienced since 2020. So our well-being investment, I think, has been very significant and a real differentiator at MedStar Health. The most key piece being the investment of people and funds to establish a MedStar Health Center for Wellbeing that occurred in 2021. We now boast about 12 people on that team who are really responsible for supporting those other 30,000 lives that we have in our organization. Many of the team members are on the ground, on site in titles like mental health coaches and nurse wellbeing specialists. So their role, their singular role, is to be present in our facilities, supporting certain territories and regions, understanding and really driving a well-being culture within our organization that our top leadership has really embraced through the development and formalization of that Center for Wellbeing. So a deep commitment to the well-being mission there. And our well-being story even predates the Center for Wellbeing formalizing 3 years ago. We started with maybe a little bit more siloed and job role focused well-being efforts, largely beginning with our provider population there, but call it a response to COVID, some catalysts there, really standardizing and merging together the various efforts that might have been a little bit more separate and siloed to make this more holistic investment in associate well-being. And with those programs, we now can help our associates navigate so many different needs that they may have, everything from finding routine childcare or kind of unexpected interruptions to their child or adult family member care with backup care services, to connecting them with concierge type programs that really take the burden off all of the time and energy we invest to researching contractors for home renovations or travel arrangements. And then, of course, supporting associates who are in crisis, whether it be a crisis that occurs on site at work or in the household.
So that's a lot and impressive. Thank you for sharing that. Wanted to just do a follow-up really with both of you, Shane and Russell. And Shane, you did talk a little bit about this already, so maybe we'll start with you. But COVID has changed really everything, and some of it probably permanently. But one of the things that we know about sort of the shift in healthcare, a demand for certain healthcare services, is that there's been about a 25% increase in the prevalence of anxiety and depression, and that's a worldwide sort of estimate, not unique to the U.S. But thinking about that and sort of the driving towards a more holistic, whole person perspective of healthcare, how does MedStar make sure that behavioral health and wellness benefits are a priority and have kept pace with sort of the underlying changes in the world and in daily life?
Yeah, such an important question. And fortunately, the answer for us is that we've leaned into this directly, both from the benefits and health plan side of the house and also the well-being side of the house. We've made numerous initiatives and interventions to really directly address this sort of stuff. You heard me allude to our on-the-ground team members who are there again, building a rapport with our associates, building trust with them, especially in a healthcare industry where things like asking for help around their mental health can still be seen as so stigmatized and there's so much hesitation around it. That's integral and I think a real difference maker for us. In terms of initiatives and programs that we've rolled out, an in-house expedited mental health connections program that works not just for our associates, but also for their children, meaning we are going to ensure that our own folks get connected through in-house connections to psychiatry services, the initial triage they need when they raise their hand and say, hey, something is wrong. I do need a little bit of a mental health check-in here, either for myself or for that child. They're also there to help ensure that they get connected to ongoing mental health care should there be a recommendation to seek ongoing counseling there. So really allowing our own associates to get that expedited support that leaves them waiting only a matter of 1, 2, 3 business days to be seen by a provider and get that crucial initial triage when something does feel off. Similarly, for those who still feel that stigma and that hesitation to reach out, we have an anonymous tool, a standardized screening tool referred to the interactive screening protocol that's adopted by folks like the American Foundation for Suicide Prevention. And this allows our associates to use an anonymous platform to complete a standardized questionnaire, assessing that level of mental well-being, and should they be flagged as at higher risk, continue to get tailored personal support from our mental health coaches, all while remaining anonymous if there's just too much resistance to identifying themselves throughout that process. We've rolled out a robust stress first aid program, which adapts from the VA, the Veterans Affairs, and use this as a great tool to help us start socializing simple terms that are maybe less stigmatized around expressing a level of distress that a person might be in. So rather than, I'm really not myself today, something traumatic has happened within my household, something I'm less comfortable sharing with others, it's, everyone, I'm feeling a little bit orange today on a color-coded spectrum of green to red, which we can all interpret and apply in a matter of seconds. I can express that I'm not quite myself and might need a little bit of help at work today and need some peers to look out for me. And we've had crucial interventions where folks have been brave enough to identify themselves as a pretty deep shade of orange or red, and we've pulled that nurse off the floor. They may not be in a state where they're ready to care for patients. Their peers have rallied around them, and because we have that well-being education and socialization of skills like stress first aid, we're able to get them the support they need and connect them to the next level of care that they may be searching for.
That's great. Russell, how about same question for all of you at Pfeiffer?
Sure. So we offer on-site EAP. So we have a PhD on site, so accessible through all means of communication, direct walk-in, virtual, text. So we make her and her team available to everyone. 2 years ago, we did conduct a formal deep dive mental health parity analysis. And from that analysis, we intentionally made our network more robust. So backstopping our on-site EAP, we have 18 direct contracts with psychologists and psychiatrists here in West Alabama. The intent is at the point of need, we're able to ensure that our plan members can access those services within the same week of the request. So the intent was to not have access as a barrier to that care. In addition to that, we have a first responder team here at Pfeiffer. All of the supervisors and team leaders and managers are trained as first responders. And then last year, we had those first responder teams go through mental health emergency training taught by the University of Alabama. And so that has been very helpful in identifying crises to ensure we get appropriate navigation to the right providers. So I think we also were very interested in alternative therapies. So for example, we've adopted the transcranial magnetic stimulation technique, the TMS, that's FDA approved for that treatment-resistant depression. So we have quite a few plan members on direct contract receiving those services and are having just phenomenal results. So we are very excited about alternative therapies as they come online and as providers adopt those techniques. We're early adopters and in the forefront of trying those therapies if we believe that it's going to help our plan members in that behavior space.
Wow. I have one more topic I want to cover with the two of you. Marcy, if you'll indulge me just for one more sort of benefit specific. And I think you each touched on this in different ways in the previous two answers, but just to sort of drill down a little bit to talk about technology and data. And how have those helped you determine how to design your benefits. And examples could be technology that becomes a benefit, like a telehealth or a virtual wellness solution, or data that helps you identify like claims data or other analyses to determine sort of what you should be targeting to improve the health outcomes for your respective workforces. And I think we asked Shane to go first last time, so why don't we start with you, Russell, for that question?
Sure. Yes, we are in our data. So as a employer plan sponsor, I'm stuck in first gear if I do not have my data. So we study that. Of course, we also look at it from a population health perspective to benchmark, chronic conditions and those different disease states in order to ensure that our programs are effective. We use 60% threshold for utilization for everything that we do. And the reason is because if we're looking at outcomes within the data, if I don't have high utilization, then a theory of causation begins to fail. So we try to do direct links between the data points and the plan members that are utilizing those different tools. But we approach the data and look at it holistically, but we also use it in program design. So as an example, we're a manufacturer. I have 1.5 million square feet. It's concrete. My employees are on their feet. So that looking at the data, MSK events are directly correlated to that experience. So that is a primary driver on why we launched the project to build a chiropractic center. It wasn't for employees just to feel good from being adjusted and those type things, but it's really to get after MSK early before a disease has a chance to set in. So I also believe the technology has been important. With our on-site facilities, we had our doctors board certified in California and so forth. And through technology, we're able to extend them to those other states through telemedicine and other facilities that we have here in Alabama, and at night and on weekends. So we're actually operating through technology a telemedicine solution with a concierge approach. So when those plan members are connecting with our providers, when those providers pull them up, they know everything about it. And so the quality of their care can be much greater because of that deep knowledge of the plan members' situations and experience.
That's great. Yeah, it's technology. I mean, right? We would not have been having this conversation this way a few years ago. So Shane, I think you mentioned that you've leveraged technology as well. So would love to hear from you.
Yeah, we sure have. And you're right. It's been crucial for any organization in any industry the last several years to keep up and keep competitive. We have numerous data sources and streams that are crucial to our benefits plans, our well-being approach. Certainly, as you mentioned there, health plan claims, pharmacy data is going to help inform us. Russell referenced EAP. We work very closely with ours as well in terms of capturing data on things like case utilization to understand that we are as much as twofold above the industry average for healthcare in terms of the use of counseling services that are free within the EAP program, which we view as a tremendously good use of that resource that we offer to all of our household members and their associates and their household members. We also participate in consortium data collection with others in the healthcare industry across the nation and our own organizational surveys, which give us important data on our associates' perspective on crucial well-being and other topics, and have been working on really building our own in-house data collection too. So as far as surveying goes, twice per year, we're able to assess important measures from our own associates and really take that feedback to help shape things like our well-being programming. I can't tell you how many programs have really been shaped and molded by that associate engagement and the importance of them lending their voice to what their needs are and what their really looking for out of their employer to be a next generation leader in the healthcare space. Simultaneously, that's helping us with keeping our own stakeholders informed as well. So from those that work with the Center for Wellbeing team at a local level, those who are in executive leadership roles, we want to make sure that they're able to pull salient data points that help inform their approach, because none of this is done within just one single shop or team at MedStar. It has to be shared across all of our collaborators to help ensure that for an organization of our size, we're really making a difference and using that data to form a comprehensive approach. I'll leave it there, but there's so many ways in which our data and technology approach is essential to staying competitive and at the forefront.
That's great. I appreciate the opportunity to hear from both of you how your respective organizations are really leveraging innovation and flexibility to address the needs of your workforce and try to, keep them healthy and satisfied with their coverage. So maybe to shift to sort of the bigger picture here, and Marcy, we're going to start with you. All of this obviously costs money. And so recently the Business Group on Health projected that healthcare cost trend will jump to about 8% next year in 2025, up from 6% back just recently in 2022. That would be the largest increase in more than 15 years. So I wonder if you could talk a little bit about how employers balance the need to attract and maintain the right workforce and the right talent by offering sufficiently generous and responsive health plans, while also staying mindful of the rising costs of care that they want to provide.
Sure. And that same organization that cited that increase in cost for employer health plans, they also released a survey, I think last year, that showed that it was over 90% of employers felt extremely strongly about their ability to offer health insurance to their employees, that it was by far a priority for them in their business practice to be able to do that. And then in kind of on the other side of those statistics, we have over 3/4 of employees that have employer provided coverage saying that they are satisfied with their coverage. So and that includes the type of coverage they have, the networks, whether they feel that it's quality care, all of those pieces. So when we kind of put all of that data together, we do see those increase in costs, but we also know that it is still going to be a priority for employers to continue to offer this coverage, which is also why on an advocacy level, we do work so hard to protect employer-provided coverage here in DC. And I know Reggie mentioned it's the 50th anniversary of ERISA. So we are all celebrating that and celebrating the protections that it provides for folks like Shane and Russell to offer such comprehensive benefits. I think when you hear them discussing the benefits that they are offering to the employees and their plans, you see why so many people are satisfied with their employer provided coverage, because employers do need to offer competitive coverage with broad plan benefits to be able to maintain and recruit their staff. We just released a survey this week that also shows that a vast majority of employees do cite benefits as a reason they went to their current job and a reason why they're staying in their current job. So it has, a huge impact on the lives of the employees, but also on the functioning for the employer.
Yeah, that's super helpful context. And Shane and Russell, I wonder if you have a perspective from, being part of the team that puts together those benefits and has to deal with the sort of balance that we talked about between what it costs, but what it's worth to your workforce. We could start with you, Russell.
Retention begins with benefits. That's HR 101. You have to have it. We also believe that in addition to having barrier-free healthcare, no-cost healthcare at the point of service, it as being the right thing to do for successful outcomes. It also elevates us as an employer of choice in our recruiting area, whether it's here in Alabama or California, when we're able to offer a benefit package this rich, and furthermore to let the employees know and their families as plan members that they are part of our healthcare design. So every year we have a Lean Six Sigma Kaizen event, and on that Kaizen we will always have a spouse, a husband, a wife of a plan member attending that event. We want their voice on that Kaizen to make sure that what we're building for next year and the year after that is our benefits that are needed by our local families. So that helps us prove out the different hypotheses that we operate by in order to have great utilization within our innovation. So that's an important KPI that we do measure. If we're not building, if we're not designing great benefits within the healthcare plan that are utilized by our plan members, then we have not succeeded. So I do believe because of that, that's been a key driver in our ability to hold costs down. So for example, when a plan member needs to go see a specialist for a surgery, if they'll go through nurse navigation, we will waive all out-of-pocket costs for that episode as an incentive, as a reward for their behavior. So we try to make it mutually win-win for all parties involved. So that's been our approach, and it's been our results for multiple years now.
Yeah, thank you for that. Shane?
Sure, and Russell certainly alluding to it there. Your benefits will really define a lot of your retention and recruitment efforts, no question about it. Certainly in our benefit plan space, recent years we've made changes to expand that behavioral health network for associates who opt into one of the health plans that MedStar Health offers to its associates, which routinely about 2/3 of our eligible folks do opt into. Also aiming to reduce copays around kind of recurring care that you might see, things like physical therapy, reducing those copays there for folks to be incentivized to finish out the care that they're being prescribed by their caregivers there and make that full recovery and be their healthiest selves. But it's also making sure that we are differentiating in things like that well-being space that you've heard me talk about there. So several ways that we really lean into that. We aim to have a national presence that everyone is hearing about and maybe even learning a little bit from when MedStar Health positions themselves as a leader in the well-being space. We host an annual nurse well-being conference here for the last several years. We've doubled our attendance in the 2024 edition of that event and pulled attendees from half of the states in the US there as we gathered folks to really focus on a crucial healthcare population, that nursing population, and make sure that their well-being is prioritized and that they feel cared for at a different level at MedStar Health versus maybe one of our competitors that they could choose to work for. We've also had the honor of being recognized at a state and a national level. Maryland offers a Healthiest Maryland Businesses program that evaluates state businesses on a multitude of different areas to kind of independently third-party assess if they're delivering holistic well-being offerings to their employees. And fortunately, many of our hospitals and entities across the larger MedStar Health organization have received that accolade in recent years, as well as the Wellness Council of America's WellCOA Gold recipient. We're a gold recipient for the last 3 years. So a number of different recognitions there. Similarly for our provider populations, the American Medical Association Joy in Medicine Award, Daisy Foundation, which is nursing specific recognition. We're really aiming to differentiate ourselves in part through our well-being programming that we can confidently state is different from what you might find in other employers and leading on a national stage.
That's great. Sounds like you're doing a lot of really good things, both of you at both of your companies. So for this question, sort of want to try to do the same thing. Hear the more granular examples from Shane and Russell, and then get Marcy's sort of more national perspective. I think the biggest sort of topic in healthcare is what we call social drivers of health at CareFirst. Other folks call them social determinants of health. But really sort of, in the last several years, we have come to much better understand that our neighborhood and the built environment, our social and community context, and other non-clinical factors has a really significant influence over our health outcomes. With the workforce becoming increasingly remote and mobile, particularly since the COVID-19 pandemic and technology to support remote work, wondering how you've responded to ensure your benefit designs factor in these social drivers of health. And maybe Shane, we can start with you on this one.
Sure, you're right. Dramatically different landscape for folks to navigate there. We're leveraging tools that are available to us. One of them being CareFirst's own wellbeing platform that allows for all of our associates to engage in a number of self-led programs, courses, and resources that help them build their own wellbeing knowledge and foundation. We incentivize engagement in the program at certain points throughout our plan year, and offer everything from maternity programming through that platform and health risk assessment services and tools too. So for our associates and really meeting them where they are, which is often on the go and preferring to use modern means of engagement, they have access to this tool regardless of whether they're covered under a health, one of our health plans or not. So really important to make sure we're being as broad in delivering these resources that meet associates where they are. In terms of our well-being strategy across the organization for our own associates, it's really a collaboration from a organization or system level and at the local level. We can roll out new programs across the system adopted at that Center for Wellbeing side of the house, but in order to cascade that out, in order to really saturate within our local populations, we need local wellbeing teams to help really amplify that message, bring that resource directly to our associates where they work. Some of them are able to engage in different means of communication with us and others are not. So whether we reach them via email, through memos from hospital presidents or other leadership, or through conversation on the ground with our team, we need to make sure that it's a saturated message that reaches folks in all different job roles and responsibilities. And to your point about the hybrid and remote workforce, we've gained more insight into how our workforce has evolved in terms of the number of folks who are not reporting to a physical location most days. And it's also impacted our hiring practices as we now are looking at a larger swath of potential candidates in who we're recruiting and potentially putting into different roles across the organization. So between our hybrid and remote workforce wellbeing committee, who's really continuing to evaluate how we deliver as equal caliber of a well-being product to folks who aren't physically in our facilities, taking advantage of some of the events and initiatives that happen on site, to also promoting their professional success through our connected workforce mission to really plug them in and make sure their technological needs are up to snuff so that they can have as engaging and successful of an experience at work. It's been an investment across all those different areas for us at MedStar.
That's great. Russell, how about you?
Now here at Pfeiffer, as a manufacturing company, we have long believed that the number one social determinant of health is a lack of net disposable income. And so we have been purposeful in our plan design to create more net disposable income for our plan members. The The easiest way to explain it is every year in our Kaizen event process, we decide and declare a healthcare dividend for the upcoming year. And we basically tell our plan members, if you'll help us solve X, we can go and do Y. So we've had 5 dividends thus far. Our first 5 years ago, we asked the plan members to go down this path with us with direct primary care, and they did. The dividend was we were able to provide scholarship money for all of the children of our employees. And so now we have a scholarship program that's funded through healthcare savings. And every year we do that. The third year we opened a fully paid, zero cost summer daycare center at our wellness park. So we provide a little over 2 months worth of free summer care to all the employees. Last year, it was, employees wanted a zero copay pharmacy. So we built a pharmacy. So we, over that time, I think an effect that we had not planned for, because we were slowly eliminating out-of-pocket cost, we decimated our Section 125 cafeteria plan because plan members were not having to allocate monies for out-of-pocket spend because we were eliminating that burden. But we were able to counsel and shift our employees with those pre-tax dollars to retirement readiness. So over 5 years, we have gone from the mid-70s to now my plan members under the age of 60 are 97% retirement ready because we were able to repurpose those monies. This year, from last year's dividend, we launched a quarterly bonus. So we fund that bonus through healthcare savings. And the intent was to provide monies for child care, aftercare, adult care. And so now employees, it's $500 a quarter. Next year, we want to move it to $600 a quarter and so forth. And so we continuously attack, especially with inflation being such a burdensome tax on our working families. We still remain intently purposeful in trying to remove out-of-pocket costs for healthcare, so it frees up things that have real value to our families.
That's great. It sounds like really both MedStar and Pfeiffer in very different ways have been really innovative and very creative in sort of trying to meet multiple demands that the workforces have. Marcy, I wonder if you could sort of provide the bigger picture perspective on the role of social drivers, and again, sort of particularly thinking about how the workforce for so many employers has evolved and changed. It makes me feel older than I even really am when I think about how many years I spent going into an office Monday through Friday. So would love to hear your perspective.
Sure, and I really enjoyed hearing the examples that Shane and Russ were giving, because when I'm here talking to policymakers, one of the big pieces that we discuss as a benefit of employer-provided coverage is the flexibility and the ability for employers to be able to craft these plans and coverage around what their employees really need. And you guys just gave wonderful examples of that. You're welcome to join me on the Hill anytime to share those pieces, because we like I said, we talk about it. The flexibility of coverage, the ability to have similar coverage regardless of the location of the employee, but the examples that you gave really bring that to life. And that's another piece when we're looking at social determinants and Also looking at the types of plans employers are offering, because they're protected by ERISA and protected by federal laws. It does enable these employers to be able to offer coverage that is similar regardless of the location of the employee. I think, Russ, you were saying you have folks in California and Alabama. Shane, I know you guys are across Virginia, Maryland, DC, so you're not always going to be in the same plan. But with the plan designs and the way that ERISA is structured, you're able to offer competitive and comparable benefits regardless of where that employee is. And that's really important, as you all know, not just for the benefits of coverage, but also for recruiting and maintaining employees. So I think that's a big piece. And then also, of course, and this was mentioned earlier, telehealth and the ability for employees to be able to access care regardless of where they are, if it's if it's clinically appropriate for them to be able to access care through telehealth, so that they can be more flexible in how they're accessing their care regardless of where they are.
Yeah, excuse me. Thank you for that, Marcy. I couldn't agree more that we've had some really good examples that I think really hit home the point about flexibility and innovation. But it takes work to pull that off. Right. So just to round out the picture for folks, I was hoping that we could hear from all of you a little bit about sort of what goes on behind the scenes to craft and build the impressive offerings that we've heard about. And obviously, many employers who are not represented on the call do the same thing. But there is a process that folks need to leverage. And maybe, Marcy, you can sort of set the table for all of us, and then we can hear from Shane and Russell about what actually happens at their organizations to pull this all together.
Sure, and of course it's fall, so we're going into open enrollment season, right? For and for most employers that are renewing for a January 1 start date. So I know benefit design is definitely top of mind there, and I'll let you all discuss the really nuanced ways in which you develop your plans. But I think when we're looking at all of the work that goes in on the employer side of how they structure their benefits, it's really important that we also think about, and we discussed cost a little bit earlier, but in some of our surveys, it showed that employees do not realize the amount of funds that are going towards them in the form of benefits. And when they are then told how much is covered by their employer, they're usually shocked. And so I think that's also very important to talk about and make sure that employees are aware of just how much the employers are contributing towards them. And then also make sure that they're aware of their coverage, right? I think that's another misconception, is just sometimes a lack of knowledge of what the employer is providing and what coverage is available to employees. So all important pieces to put together as we're going into open enrollment season.
Great. Russell, maybe we can start with you. Can you give us a high level view of literally what does it take to pull this all together and have new and evolving benefits every year for your workforce?
Yeah, I'll tell you, paramount is our ability to gain our C-suite and owners backing, and on our Kaizen events, we'll always have senior leaders serve on that event, so they see how the sausage is made, and they buy into what we're trying to achieve. They hear from the shop floor employees, and they hear from the spouses. So that really helps. But we're very deliberate. It's very calendar based. We'll report to the CEO-led healthcare committee twice a year, May and September, that allows for the actuarial studies, that allows for the large national publisher houses to really put out some data as far as what's going to happen the next year. We look at all the analysis that we do in-house, especially when it comes to population health. We like to see what's happened during the first 2 quarters of the year so we can really understand where we're at and what we might have to do to adjust mid-year based on some, and how to nuance some things that we had not expected. So I would say we're very deliberate in our planning. It takes a very resourced and empowered, educated team to pull all this off year over year. But I'll say the most important thing is that I'm the leader of HR for our corporation. I work hand in hand with my CFO and my CEO and company president on healthcare. So I think without having C-suite partnerships and all the initiatives that we're trying to do, because everybody has a different appreciation for healthcare, what it yields, what it costs. And so to be able to pull that all together so that it makes sense for 2 people, it makes sense for the business, and it makes sense for the plan members. And when we stay at balance in those things, then we're delivering the right, nimble, and innovative plan that meets the needs of all of our families.
Great. And Shane, how about the experience at MedStar?
Yeah, Russell hits on some points that really are top of mind for me as well, which is that leadership involvement and partnership, and whether it's at the most senior levels and executive leaders, or for us in well-being programming, it's with our stakeholder partners. It's folks like our diversity, equity, inclusion teams, our HR teams, our quality and safety. All of these groups are essential to us building a comprehensive well-being program that pulls available data, pulls available expertise. And we have so much expertise in-house, especially when it comes to building well-being programming, delivering medical care to our own associates. We have so much perspective and knowledge in-house that we simply need to make and continue to grow those connections with the other essential teams that help us be as comprehensive and as thoughtful as we can be around our approach to health plan delivery for this year and years going forward. It's foolish not to use the resources that you simply have at your fingertips there through other parts of your organization. Another essential piece for us is just the modeling and the messaging that comes from our leaders as well. And I think it's a real differentiator at MedStar that we can say with full confidence and not feel phony at all about it, that our leaders are walking the talk when it comes to things like well-being, whether it be their messaging, whether it be their direct involvement in offerings and initiatives, their testimonials for use of well-being programs. These are all things that help drive that essential buy-in, that help us feel like we are continuing to successfully message our programs, communicate new ones as they're rolling out, and just show that they really are being used, and that it's okay to sometimes show that vulnerability that we look for our leaders to sometimes bring to the table, to give that resounding endorsement for use of all of these programs. And finally, for us, it's continuing to hear the needs of our folks, continuing to keep an ear to the ground. So you heard me mention some of the surveying that's done, of course, the data and the claims metrics that we're able to keep our fingertips on to help ensure our plans continue to grow and evolve and address some of our highest costs and some of our trending health claims and issues that are emerging for us. And finally, just removing friction for our associates and their family members is so essential. One of the unique challenges of offering something so robust in something like a well-being program is that it can come across as overwhelming. So recognizing that associates are sometimes coming to us and discovering or searching our services in a moment of distress where it's hard to give your attention or think clearly or come with composure to find what they're really, really looking for. So removing friction, finding it easy to navigate to the resources you really need, and to do it without the hesitation or the stigma that sometimes still continues to plague an industry like healthcare.
Yeah, appreciate the sort of peek behind the curtains of what it's like at MedStar and Pfeiffer. And I think probably similar experiences for employers all around the country. So I'm mindful of time. We have just a couple minutes left. I thought I would offer all of you the opportunity, if there's anything that you want to sort of say in closing, or anything that I didn't ask about, but you were hoping to have the opportunity to highlight. We do have a couple minutes. So it looks like Russell came off mute, so I will start with him.
Sure. I would say the only thing I didn't mention, or one of the things I didn't mention, is it takes great partners. And I will say now, 5, 6 years later, after we got underway, the partners we have are not the partners we started with. Sometimes it takes courage to make that change. I think when we look at what's at stake, we look at our children, our plan members, they're what's at stake. So that helps us, emboldens us to hold our partners accountable. And if they're not willing to be accountable, then we've had to accelerate our ability to make change when needed. So that's an important part of this as well.
A great point. Shane or Marcy, any closing thoughts?
Just once again celebrating the 50th anniversary of ERISA and reinforcing employer-provided coverage in this country and across states. I think it's really important to make sure that we continue to share these amazing stories and examples of employers that are holding themselves accountable and truly serving as fiduciaries, as the law intended, to be able to provide coverage and care for their employees.
Yeah, that's great. And Shane?
Yeah, and really nothing significant to add here on my end, but certainly would echo some comments from Russell around the importance of staying active and continuing to evaluate the landscape when it comes to all of your partners, whether they be for health administration, employee assistance program, or otherwise. Important to make sure your organization and your resources evolve with changing times and making sure you're delivering a high quality product across the board.
Yeah, so I think we all are in agreement there. Really want to thank the three of you. You've been incredible panelists. I've really enjoyed the conversation. Appreciate, excuse me, the valuable insights you provided into how benefit plans are built to address and even anticipate employee needs and keep your workforce healthy and engaged. Also, of course, want to thank everyone who joined us today to listen in. Employer-sponsored health coverage is the bedrock of healthcare coverage in our country. It plays a critical role in providing employees and their families with access to comprehensive and cost-effective benefits. CareFirst is certainly committed to ensuring employer-sponsored insurance remains a viable mechanism for the nation's workforce so that they can access affordable insurance coverage and affordable health care. With that, really just want to thank everyone once again for your time and for joining us today, and a happy 50th birthday to ERISA. Thanks, everyone.